Hello, and welcome back to the LFA Purpose Podcast, where we offer fresh insights to help you rediscover the clarity and courage that already live within you. I'm your host, Father Leo Armbrust, and in each episode, we feature guests who share something in common in their own way. They are healers within their profession. They have allowed their passions to guide their path. I'm excited to speak with today's guest about something we tend to overlook, the connection between body and mind. When they are in balance, our minds begin to declutter and clarity can come through, which helps us to slow down and reflect. When your mind is clear, you can begin to ask yourself, what truly matters? What kind of life do I want to live? And how can I contribute to the world around me? I'm delighted to introduce to you today a very good friend of mine, Dr. Maria Bago, founder of Vitality with Dr. Bago. She is an exceptional human being. We've been friends for quite some time and was my general physician. She is also certified and a pioneer in holistic medicine. She believes that healing begins with a clear and healthy mind. Hello and welcome back to LFA Purpose with Father Leo Armbrust. I'm here with my guest again, Dr. Maria Bago of Vitality with Dr. Bago in Wellington, Florida. Dr. Bago, I have not shared this story with you, and now I'm going to drop it on you. Okay. Years ago, when I first went to see you and I was a patient in your practice, I think I may have told you that my father, who was then 70 years of age, had been diagnosed with prostate cancer. And as you well know, I have an irrational fear of needles. I've been to therapy about it. I've countless numbers of people. And one time I went to a therapist and the therapist asked me, was there ever a time when you were a child and they told you that this shot or this vaccine or immunization wasn't going to hurt? And I said, yes. And then she said to me, did it hurt? And I said, yes. And she said, you have been reliving that situation ever since you've been a child. Mm-hmm. And that fear is completely irrational. So regardless of that, I deferred and put off what should have been my healthy reasons for me taking care of myself, because you know better than I, prostate cancer is a genetic predisposition. And so you were the one that said to me, I'll never forget this, Father Leo, you have got to go and get a biopsy. Because of it, I found out 5 years ago that I do have prostate cancer. And I found out it was low grade and not very aggressive. So I owe you a huge debt of gratitude, because without your convictions and saying, well, Leo, you need to do this, you need to be more responsible. Yeah. And I did it. Thank you. Now,
thank you. Thank you for sharing that.
But this is the kind of doctor you are. This is the kind of person that you are. You have no fear of investing your personal life or your profession, your compassion in your patients. How did you get those skill sets? Did you learn them? Did you have them from birth? I mean, tell us about that.
As much as I could have the answers for my patients, they would maybe do as told or take the medicine as told, and then there'd be this reversion. And it's almost like a setback. And it's always compliance is the word we use in medical term. And so for me, it was always finding out what was holding a particular person, a patient back. Because at the end of the day, the answers are there. They know what to do, but they don't do it anyway. And so if we could find out what's really underneath, who's the person underneath the body inside that's driving the vehicle, right? Then we're going somewhere. But there's only so much you can do on the outside if we don't address that inner world. And I think in order for me to be more effective as the healer, as a physician, as a guide, I had to do that in my own right.
You can't give what you do not have.
Yeah. And I think after 20 years of projecting a version of me that I thought a society and what was expected of me, I too was in my own setback, and I needed to take that time to find out, well, what's holding me back? What's holding me back from being able to speak the words that I want to? And and in practice, I'd always be like, yeah, this is what I want to do, but I can't say it because this is what I'm told I'm supposed to do. And I had that very um, do as you're told, follow. But then there was always a part of me that was like, no, okay, you can do your lipids, but this is really what I want you to. So it always I tell my patients, I go both ways. I'll do traditional, but I'm also going to tell you what you need to hear, and then you can decide.
That's a great approach.
You can
Give them
decide.
options.
I give them
People like
options, and I
options.
would always give them options. That you can do the lipids, or I can sit there and talk you. Just tell me up front which way you want to go because, there are some patients that just want the pill, and that's fine. And then there's some people like, no, doc, tell me more. And so the wellness center in and of itself was born out of that need to want to give patients other options. So the wellness center was literally born 2 years into the opening of our practice 20 years ago. I couldn't dedicate enough time between being a doctor, being a business owner, having 4 kids, and now I get to really embrace the home I was meant to be, and I'm not afraid
And
anymore.
you get to be the person you've always wanted to be.
Yeah, yeah,
That whole journey in your own personal life has improved your skills as a healer and a physician
yeah,
because you realized something about yourself that was impeding your own development as a human being.
yeah,
And when you focused on yourself, everyone else around you benefited because you took yourself as a priority and made your own healing that important.
yeah, yeah,
That's very consequential. It's exactly now what you're trying to do in translating that to your patients, helping them become better versions of themselves is a path to healing. And how do you do that but having them understand that it's just not one facet of themselves that's hurting or that's in pain, but how it's affecting the others, and that if you don't address that, you're gonna continue to suffering, and
yeah.
all the pills in the world are
Well,
only gonna delay the inevitable.
yeah, and that was I call it the handcuffs of traditional medicine within a say the word insurance, but the way the system is organized now and what I'm able to do at Vitality right now is I give patients all the time they need to kind of create for them the plan that they need that's individual to them at their pace. And I'm not locked into this 15-minute rush to get them their drugs they need and the documentation that's needed. I'm able to really sit down and treat them as human beings and not just a number. And it's gratifying. And I think another thing that comes up for me as I start to understand my purpose in developing vitality is in my own journey the people I thought that I dedicated my entire life to that I thought would be there to support me and or lift me up when I was down didn't happen, but I do believe that God placed people, things, events in my life to help me get up. I wouldn't have succumbed from my own journey if it weren't for people being there for me. And I feel like I this is my time to give back to those individuals, my patients who've been there for 20 years, the people that have been in that journey. I feel like if I can be that person for someone, wherever that is,
This
then
is a
I've
dimension
done.
of your spirituality into your whole understanding of wellness, not only for yourself, but for others.
Yeah.
You're looking at signs on the path, on the journey,
Yeah.
signals, messages from a divine being who's trying to help you help yourself. And in so doing, pay it forward or have others benefit from what you yourself are learning about yourself.
That
And when
is
you begin to share those kind of stories and those narratives with other people, they don't feel so isolated. And most of all, you know what they understand, Maria? They understand you care. They understand that you understand them. What a relationship you can then create with your patients. It's all surrounded about trust.
Yeah.
When a patient can look at you and say, "You know what, doctor, I trust you." I don't know if there's a more magnificent compliment you can pay from a client to a doctor
Mm.
with their lives. "I trust you. I'm placing my life in your hand." And you're responding by saying, "Oh, well, I want you to know I care about all of you,
Yeah.
not just one small part of you, but everything about you." Medicine has to change in a great many ways. It's understanding them and not putting them in a shoebox.
Right.
One size fits all. I think you're breaking that mold. And you took your 2-year sabbatical after all the years of schooling and learning and education and even the experience you had for 20 years prior to this. You've taken all of that and now you've developed this practice. You've got to feel really good about this.
I'm I feel great about it, but I think what I feel most is at peace. Um,
Liberated,
yeah, it's
free.
so it's a feeling great, but it's because it's coming from a place of peace, congruency, and alignment. What I recognize now is even though I practiced traditional medicine for 2 decades, there were signs the whole time. It's like, "Okay, we'll do traditional, but let me put a wellness center." And I would still practice, here's your pill, but I would always revert back to lifestyle medicine. I'd revert back to functional but I'd never allow myself and that, to fully express that, for fear of being judged, for fear of being criticized, for fear of being ridiculed, for fear of the government, just every, that fear that we had, alluded to. And I feel like now the fear isn't there. I'm at peace because I'm aligned, I'm not, constricted, and I think that has to come because what needed to be processed inside has come out. The little child, the girl that had been constantly, put aside had the ability to.
You had to examine the levels of attachment that you had as a youth
Yeah,
and what those attachments meant to you as you've grown older
yeah,
and how whether they were productive or counterproductive. And at the same time, like this LFA purpose is look, find, and align.
yeah.
And when you start to look, a whole new awareness comes on. It can be terrifying to see, oh, I don't want to look there. I want to ignore that.
Yeah.
And then once you find that, then there's the temptation to either ignore it or say, "Well, this looks enticing. This looks very, very seductive. I've got to find this."
But
And
most people won't do that. Here's the
no,
thing,
that's
when
it,
they don't
right.
look, it comes out as anxiety,
Yes.
insomnia, depression, and so what medicine does is let me label it and let me give you a pill for it. So
Or they numb it through
they
addiction,
yeah,
drugs and
absolutely. There's
alcohol, other
alcohol, there's
forms of
drugs. So it's interesting because the one thing that most of us need to do in this very busy, socially connected or unconnected for that matter is stop. Stop scrolling. Stop being busy. Um, just stop. Take a breath and listen. So I love that you have that, looking, right? Take a look at what's really going on. And when you stop, that's when those feelings of anxiety come in. That's when all of a sudden we go, no, 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 let me keep busy. Let me distract. But that's going to give you the direction, the path, the map on where you need to go that we all want to avoid.
it's it's becoming aware and becoming more conscious.
Yeah.
And I think once you start traveling down that road, it can be terrifying.
Yeah.
What you're going to discover on the other side is you're going to be in a place you've always wanted to be, but you were afraid to take the risk.
And once you open your eyes, you can't
You can't unsee
it.
that.
You can't
cannot
unsee it.
exactly.
Your mind can be strong enough to avoid it, but that will always lead you back to that level of incongruency and disalignment that will manifest either emotionally, mentally, physically, as back pain, as shoulder pain, as well, there have been many of studies that have even shown like throat cancer or thyroid issues come from when there's a lot of suppression in someone's ability to speak their words. It will manifest one way or another, and that's the part.
Psychosomatic. You
Yeah,
have just hit the nail right on the head. Our physical ailments have to express themselves in some way. The same way with our emotions. We can only keep them bottled up for so long before they will exhibit themselves into self-destructive behavior
yeah,
or symptoms.
yep. And that's the my year at in the addiction medicine fellowship really showed me that light.
Are you
Showed
worried
me.
about the future of medicine when you think it's just a matter of prescribing medications where there's nothing other than the context of treating the whole person? Are you worried about we ever getting to that stage?
So it's kinda twofold. Where medicine is going from the research and the science is it's helpful. There is a place for it. We need that for treatments of cancer, of diseases that are already present to be able to help people when the diseases have already manifested. But understand that that's not just medicine. We have another aspect, which is your prevention, it's your daily life, it's your balance that in and of itself is another kind of medicine. Food is medicine, exercise is medicine, sleep is medicine that helps prevent the need for, I'm not going to say barbaric, but like intense therapies. I mean, patients who go through chemotherapy, I see the suffering that happens with it. It's good because it can, and there's hopes to be able to help treat some of the most severe diseases that are out there, but it doesn't come at a price. And so I always, tell patients, I'm like, yeah, I know broccoli sucks. It doesn't taste great. I mean, it can if it's made nicely, but I'm saying for most people, they're like, ooh, I don't want to eat my vegetables. But then the other alternative is if you're not going to choose to eat and make the preventative, more supportive decisions now, you're going to be taking these very god awful chemo and medicines that are going to taste not so good or produce things on your body that aren't. So, it's a choice. We all have free will. So I'm not going to say that medicine's going in the wrong direction. I'm just going to say don't forget about the other part of
And our
medicine.
society doesn't necessarily promote that today with some of the food that we're passing off as nutrition. And
No.
the diet we're on as a society in this country is anything but admirable.
But I am seeing a shift. In the newer generations, in the younger generations, we are seeing a shift because of platforms like this, where we start to create the awareness and the education and the knowledge is getting out there. I mean, I know from when we start to look at even just the use of alcohol in our generations, our Gen Zs are starting to learn from previous
There's
generations.
been much been written
They're
lately that
they're
people are cutting back on alcohol.
they're cutting back on alcohol and choosing to do therapy. I know
Look
growing
how
up,
many people stopped smoking because we took a concentrated approach
yeah,
that smoking and tobacco is dangerous for you.
right. We are seeing it. So, I continuing with the promotion of platforms such as these are going to make a difference. I feel like it's what comes up for me is the it's a story I heard about the 5 blind men touching an elephant, and they will all describe their portion of this elephant, but you're only limited to what you see, but when you can take the entire picture and understand what
You have
is
a
in
better
front of
picture and
you.
understanding.
Yeah. I mean, medicine is great. There are some things, if it's genetic, if you need the support, and I think where medicine is going is great, but it's not the end all. It's not the end all.
I believe that what you're sharing with our listeners and viewers today is so critical for especially elderly people who don't always have the advice and counsel of the best people around them. Sometimes they might just be by themselves. They don't know where to turn. How would someone find a doctor like you? Where would you look? I want to find out what more how many other people like Dr. Bago are out there? I mean, she talks in such a way that I wanna be her patient because she seems to be focused on what's in the best interest of my well-being and not just going to give me a pill, see me for 15 minutes, I put down my deductible, and I'm out the door.
Right. So there are many physicians that are now, in addition to their medical training, getting the extra training that they need to be able to support this. So it be it functional medicine, integrative medicine. It's even naturopaths are starting to be more present within our allied health care support. I think so. The question you're asking is how to find
Someone
doctors.
like you.
I find that when you look at it's being able to look at their studies, looking at their philosophy. Not everyone wants this. What I've learned in my years of practice is some people are just like, "Doc, just tell me tell me the drug I need and that's it." So, and I love our relationship and that's okay. I meet them where they're at. It's one that, like dating, you've gotta go out there and meet them. I mean, you'll know by the interaction. You'll know by the first visit whether or not this is someone you wanna be able to care.
Well, we have been focusing a great deal in the previous, segment with you
Mhm.
and in this one about what you're giving to those who come in to see you, into your examination room, into your office, into your life. What gives you a sense of meaning and purpose as being the professional that you are, the healer, the doctor, the physician, the listener?
Knowing that I fulfilled my purpose is what's coming up for me. So, what they offer me is knowing that they're honoring me with their presence, meaning they're trusting me with their sense of well-being in all sense of the form. And that's I don't take that lightly. They're coming to me because of trust, which means I know I'm fulfilling my own purpose. So they're allowing me to fulfill my purpose. And in those interactions, I definitely listen to all the physical elements and their presentation, but I'm also hearing what or reflecting for them that part of their consciousness that they may not be aware of. And when we connect and I'm able to at least share that light, shed light to a part of them that they don't already know, I'm fulfilling that purpose of shedding light to them and getting them connected with their being, with their God, with their purpose, with their universe. And if I'm just one spoke or one step in their path, that's beautiful. Because I believe we all have this path we're taking. And I've had several in my life that were there for a moment, a season, a reason that has lifted me when I was at my I was at the basement, when I was at the floor, that have encouraged me, that have supported me. And if I can be that for them, then they're offering that light for me. I hope that makes sense.
You used a word that I think has a very Asian emphasis. They honor me with their presence. How has your traditional ancestry helped you develop into your approach today where you are as a doctor?
In Christian thoughts. It's when two people come together, the presence of God is there. What's interesting, what I've been able to enjoy in the second chapter of my life is I'm really able to honor my Asian side more. I think part of me growing up in a very Anglo or very, I'm gonna say, uh, white environment, being both Hispanic and Asian, I had to pick who I presented to the world, and so I believe there was a part of me that was like, I need in order for me to succeed, I had to suppress a part of me and not really relate that.
So you were aware of dual personalities from the standpoint of which one do you wanted to express
Be
in what situation?
accepted.
Yes,
Yeah,
exactly.
I can honor that part of me, and I recognize, people see me, and I don't look like everyone else, even in my own family. It's always like, "Are you Spanish? Or are you Filipino? What are you? Asian?" I see there's something. I wanted to be like everyone else. I wanted to be like that those around me. And as I and practice medicine the way you're told, again, that same story was very, very prominent for me. And that is a very um for female Asians, very drilled into them. You do as you say, you don't have a voice. And um for me now, not having those external influences in my life, I find a lot of my Asians coming out. So I'd love for you to be able to see the facility, but it does have a lot of like cherry blossoms. It's got like bamboos, and all of a sudden I'm like, yeah, there's a lot of like as I start to I'm doing acupuncture. I want to Chinese medicine. I have herbals in there, so I without even knowing it's coming out of
We could
me and
spend an
how
entire 1 hour talking about Chinese medicine.
yes,
I've always
I
fascinated me. Been
love
to San
it.
Francisco and to see the Chinese,
Yes.
uh, pharmaceuticals or the pharmacies and all
The
the
herbs, the
herbs and,
cupping, the gua
it
sha,
it
the needling, the
well,
trigger points. It's like it's
I believe
fascinating.
God gave us all the medicine we will ever need, but we have yet to discover it.
Yeah.
We just haven't discovered it yet. I would like to conclude today by making the following observations. You have transmitted to me today personally and to our listeners and viewers a journey of liberation in many ways, finding a new self and a new expression of not only yourself personally, but how you want to pursue a career in the healing profession.
Yeah.
And I get this sense from it's not only been from the traditional understanding of medicine, but it's developed and evolved into another, and it's done with you culturally and personally. It's like you're blooming like a flower. It's almost like your understanding of your mission has released the shackles and the fetters that you once wore into an expression of yourself that you've always wanted to be. Maria, it's been too long since we've seen each other. I am so
You need to
happy
come
that you could
by.
join us today. You have a wealth of knowledge and information, but what most is important is you have a large heart, caring, compassionate, and loving. Thank you, Maria.
I'm
God
honored.
bless you.
Thank you so much. Thank you.